guys, it's Louisa here, no Mike today. Killed him off, no. I'm here today, I thought I'd tell you a little bit about what's going on in the club. I'm not sure if you know that we've got Eliza and Baz here, who they're doing a little they've got their practice at Exercise Physiology called Inside Out Exercise Physiology, and One Health Physio Group, which is run by Baz and his team. So we're here today to actually go through about, just to give you guys a bit of knowledge about what they actually do and how they can help you. So Eliza, we'll go first. Exercise physiology, the word's been throwing around a lot. Can you explain to us what exercise physiology is?
Sure, thanks Louisa. Well, as an exercise physiologist, we have a deep clinical understanding of just how exercise can better somebody's health, whether they're suffering from a chronic disease such as diabetes or hypertension, or they've just had a baby and they're trying to do some rehabilitation postnatal, whether somebody's suffering from anxiety or depression or another mental illness, or they even have a pulmonary disease such as chronic bronchitis. Exercise physiologists are well trained in exercise prescription to specifically target and improve that person's health. So I'm lucky in the fact that I get to come to work every day and see just how my patients come to value clinical exercise in their treatment, whether it's because of their direct pathology or from something else that's kind of tags along with it. So it's really good.
Cool. Baz, over to you. So you've got a group, a physio group. What makes you guys different from the rest?
Yeah. In terms of physiotherapy, almost all physiotherapists will work a lot with musculoskeletal issues, and to have a deep understanding of that, obviously you need to have a good understanding of anatomy and physiology. But also, what's different with my team is we are all heavily into our own training as well. So we have a kind of an empathetic view towards treating patients, because we know we've been there and we've had injuries in the past and whatnot, so we can kind of know how the patients are feeling and how when we treat them, how they're going to respond a little bit better, because we've done it to ourselves. So that gives us a bit more better way of treating patients.
Yeah, and I suppose and that's the best way to do it is do it yourself, know how the body works as well as being studied. Eliza, so what happens on a visit when someone comes to see you?
Sure, well, exercise physiology is a very holistic profession, so we like to take a very thorough medical history on your first assessment, and also take you through an assessment which includes a postural assessment, a biomechanical assessment, any other diagnostic tools which are specific to your pathology, so we have a really good well-rounded view of just how exercise is going to affect your body and how exercise can also help your body. So we can make sure that when we prescribe your intervention, whether it's positive lifestyle changes, small exercises that you can do at home, or exercises in the gym as well, that you're getting the best, most efficient outcome in terms of your rehabilitation.
And what about you with the first visit with you guys? What can we expect?
Kind of similar in the sense that obviously we need to take a thorough medical history as well, but mainly kind of working out what the real issue is, because a lot of people come in and say, oh, I've got a sore back or I've got a sore neck, and that could be a handful of things, you know. So actually pretty much figuring out and diagnosing accurately what that issue is, and we do that through a lot of clinical tests, and we also order imaging if we need to, in terms of x-rays or ultrasound or something like that, or an MRI, to actually confirm our diagnosis. So that's pretty much worked out in the initial session.
Oh, fantastic. Eliza, do we need a referral? How do we go about coming to see you?
For both exercise physiology and physiotherapy, you don't need a referral, but often you will be referred through your GP or another allied health professional, or even your surgeon perhaps to come and see us. If, however, you are looking for a rebate through Medicare, your doctor can write you out a care plan, which if you've been suffering from a chronic condition for more than 6 months, or it's likely to last more than 6 months, you will be eligible for a care plan, and you can have up to 5 Medicare funded sessions per calendar year, and you're just left paying a small gap. If you're a WorkSafe or TAC patient and you have a claim number, you can make contact with us, and we'll contact WorkSafe as well. For physio, you can contact WorkSafe directly. For exercise physiology, you will need a letter from your doctor recommending that exercise is going to be a beneficial part of